Stakeholders analysis and stakeholders engagement. I am sure that you have heard this term many times. I guess maybe many of you know stakeholders better than the Russian version of this. So which one do you use often, stakeholders or the Russian translation? Okay, so then it will be easier for me. I will say stakeholders and not the Russian translation. Okay, so let's start from the basics. What is stakeholder analysis? This is a process of systematically gathering and analyzing qualitative information. This is what we go back every now and then. So quality information to determine whose interest should be taken into account when developing and implementing a policy or a certain program. Which means that this is an analysis to reveal who are stakeholders of our programs in our countries, what are their interests just within the framework of our program, and how we can cooperate with them. Any questions regarding this? No. Okay. Next slide. How to identify stakeholders. Of course, it depends upon the program, the country, but one of the ways to identify stakeholders is to answer these questions. Some of them will be useful for you, some of them will be of no use, it depends on the program. But here is this set of questions, and if you answer them, it will help you to identify who are stakeholders for your certain program in your. So since this is the last session, maybe we will make it more a discussion rather than lecture. I will ask you a question, and every country just think about the stakeholder in your country who coincides with this answer to this question. So in your country, who needs to use TB data, and what questions are they seeking to answer? Who can be a stakeholder like that in your country? Moldova, do you have an answer? Program coordinator. National program concept. I think other countries might have their own answers, but we'll work on that later. Who has influence and resources to design, implement, strengthen, and use TB system in your countries? Who can be stakeholder in this category? Ukraine, please. Ministry, donors, yes, absolutely. Third question, who will be directly or indirectly affected by the implementation, strengthening, and use of TB system in your countries? Who would be a representative stakeholder in this category? Georgia? Who will be directly or indirectly affected by the implementation? Who can be the stakeholder in this category?
Great, thank you. Okay. Следующее. Кто будет поддерживать?
Well, the next one is who will support TB system implementation, strengthening, and use in your country? Who might be the stakeholder? Anush, Armenia, please. Well, of course, first of all, this will be the head of the national program, and of course, the head of the monitoring and evaluation department. You are all right. This is only one example, and now we will have time to think about it. And we will find other stakeholders who will be there. There are more questions. I will not go through all of them, but this is kind of an example. Okay, so another exercise now, energizer, so to say. Please raise. So the exercise is just to move around a little. If you agree that what I read now is a description of a stakeholder, make a step forward. Parties officially authorized to make decisions. Is this a stakeholder? Then if you think this is a stakeholder, make a step forward. Second, parties officially authorized to block the decision. Can it be? Okay. Parties whose interests are touched by these decisions. Okay, wonderful. It was a jump, a leap. Fourth, parties holding necessary information or knowledge. Are they stakeholders? Yes, they might be or might not. Okay, that is why you're staying and not because you're tired. Okay. If you agree with the statement, make a step forward. Analysis of stakeholder engagement is done only once in the course of implementation of the whole work. No, okay. Well, this is a kind of a pre-test. And the last question, analysis of stakeholder engagement can be conducted only by the organization that is implementing the organization. Only the staff of this organ. If you agree, okay. So here I would like, okay, be seated, please. It was wonderful. We had a very nice pre-test. And for the last question, anybody can say why this was a wrong statement? So stakeholder engagement analysis.
Yes, this question
by the program.
Well, because it's not a partnership relationship. It's not. It's just subjective, individual, arbitrary, and so it's like a monopoly, and monopoly is never good, and it's also maybe a conflict of interest. That's right. Thank you. Now the analysis that is being done by somebody external. What disadvantages does it have if the analysis is done externally?
Данный анализ может включать только поверхностный подход к выявлению проблем.
Maybe just a superficial approach to identification and detection of problems.
Да, вот самое главное, что невозможно будет детализировать все проблемные аспекты.
Yeah, it will be basically difficult or impossible to identify and revise all the problems. Why? Because that person may not be a professional in the area. It may be just a professional of statistics or the IT, but not a doctor who knows all the nitty-gritties of the area. Thank you. And one more phrase, and I want to know your opinion, whether you agree or disagree. That's the stakeholder analysis affects the stakeholders only that positively affects our problems. Who says no? Tell us why you disagree. Well, because any opinion should be considered to objectively set tasks, objectives, make decisions. Because not always is good when everybody is pro and in favor. If somebody has a dissenting opinion, it's good too, because then it will help to adopt a more correct decision. That's right. And What are the other risks if we do not take into consideration stakeholders who can negatively or adversely affect our program? Well, it may lead to some mistakes and subjective decisions. That the decisions may be wrong, and if it is so, then it will lead to bigger problems than initially.
Спасибо, совершенно верно.
Thank you, absolutely right. And of course, they may block the entire program. We will not be able to move ahead. And I can bring an example. It was a program on harm reduction in HIV area many years ago in one of your countries. And the program was implemented through the local NGO. And in the limits of the program, the NGOs were distributing syringes to IV drug users, but the program was not discussed and agreed with local police. They didn't know anything about the program. They didn't know why these people at 11 or 12 o'clock at night, they are outside distributing syringes. And that led to a lot of problems to the staff, to the beneficiaries who came to get the syringes. It was a problem for the management. And that happened just because the program didn't view these people as stakeholders. They were not informed, they didn't know anything about this work in that particular district. And unfortunately, the program should have been closed. So this is really a very serious thing. So when we speak about the stakeholder analysis, then we need to take into account not only those who can positively affect our program, but those who can block the program.
Слайд, который, в общем-то, вы уже все...
Now, the next slide that you basically all listed why we need the analysis, why is it beneficial, because it gives us information, knowledge about our key participants, about their knowledge about the program that we're going to implement, the resources that they can suggest for implementation of the program, what is the best way to work with them, do we need training or maybe monthly briefings will be sufficient. So it gives us more information about who works in the area and how we need to continue working with them. And secondly, before the program implementation or the policy implementation, if we do the analysis like that, then it will help us in knowing what measures shall be taken to avoid and to prevent adverse effects. Maybe you have some other reasons to why we need the stakeholder analysis. Based on your experience, based on your countries and programs experience, maybe you could tell us.
Если нет, то вы подумайте. Мы просто перейдем на следующий слайд, но вы можете
Yeah,
подумать.
you can think about it. We move to the next slide, and I think it should be a VTU.
Now, recently we spoke about this in episode 4 of 𝗿𝗲𝗿𝗶. We were talking about how to tell your story so people care about it. Now, hopefully you've had a listen to this and you're already familiar with the concept of who a stakeholder is. Basically, a stakeholder is someone who is affected by or who will affect the business and the brand. Now, we look at the stakeholders in relation to their level of interest and their level of influence. So interest are people who are going to affect by you, and influence people who are going to affect you, and of course those people who have a bi-directional relationship with you. Now, depending on where people fall within these sort of 4 quadrants, will depend on what you do with them. So if they have high level of influence and also a high level of interest, we want to manage them closely. Where if they have a high level of interest, we want to keep them informed. A lower level of interest and a lower level of influence, we just need some regular contact. If they've got a high level of influence, but they have a low level of interest, then we need to anticipate and meet their needs. This video is specifically about stakeholder mapping in relation to growing your brand. So it's really important that when you think about how you're interacting with your stakeholders, you remember that your brand and your reputation is at stake.
Okay, so we'll stop here. И давайте поговорим о том, что мы только что увидели.
So let's talk about what we've just seen. This graph, this 4 squares. So on sides with interest, on the other hand, it's influence. We know that resources are limited. There may be many stakeholders, but resources are limited. Why is the system good? It helps in identifying who was most important for your program and who is least important for you, so that you distribute resources correctly. Who needs to be informed, just informed, and who do you need to meet on a regular basis or teach them something so that they can, help with your program implementation. Well, unfortunately, we don't have this slide. I have it printed only. Out of these 4 quadrants, out of these 4 squares that we've seen on the screen, the square that is in the upper right corner, with the biggest interest and influence. These are the stakeholders that you should pay the biggest attention to, that you need to work with permanently. Did you have any questions on this video? No? All righty then. Then let's talk about how we do the stakeholders analysis. First of all, in the world of monitoring and evaluation, we have various instruments, and stakeholder analysis is no different. For that, we have an instrument and we will work with it. After the presentation, we'll have a group work and you will be able to practice this instrument. It will help you to identify who your stakeholders are. Are they private persons, private organizations, or public organizations, NGOs, donors, international donors, or national donors? So it will give you an opportunity to make a picture, and also you will be able to identify their roles and resources, meaning what they contribute to your program, really. So how do you think you can collect information like that? And meaning who are the stakeholders in your country and what they can contribute? How and where do you get this information? Does anyone have an answer? Ukraine, please. Well, I think that when we develop a program, when we develop tasks and objectives and activities, we already know who it may apply to. At the first stage, we may miss someone, but when we work on specific objectives and tasks, then we will know who will be in charge of that or implementing, and that will be the stakeholder. Yeah, but how do you collect information about that stakeholder? Yeah, how do you know and how can you learn who or what they are and what resources they have? If the implementing agency is, say, the regional division of the Ministry of Healthcare, for instance, something, then it's everything that is written in their statutes, because it indicates their tasks and objectives. All right, so from the statute, you know many things. Plus, you are experienced people, you know quite a lot about stakeholders, and additional information can be collected by means of interviews. I mean, you can set a meeting with them and ask them questions. You can develop this list of questions so that you can collect additional information about them. This is one of the most common ways of learning about stakeholders, because sometimes they are new stakeholders. It can be a new donor or the private organization willing to collaborate with you. say you never heard of them or never worked with them. So the most common recommended method is to meet them directly, to interview them and collect the information you need. As well as you said, it's a statute or the report. If it's an established organization, of course, you can go through their website and reports before you meet them. Any other additions or opinions? Maybe somebody from your own personal experiences, please. It could be a survey, like also send out the questionnaire and ask them to fill it out. Yes, very good. What about stakeholders who work at the community level? How can you learn more about them? Say it's a civil society. It can be anonymous surveys. Oh, yeah. Okay. What if you talk to the program beneficiaries, people who receive services of this particular NGO? You can meet them, find out what they think about this NGO and their work, whether it's worth it to work with them or not. Yes, so this is the first instruments then you can use to create a big map, to identify who are the stakeholders in the country or in the region. Yeah, it's not necessarily national level. It can be the district or regional level or at the level of the community. Because stakeholders differ at the national level. It can be absolutely different stakeholders. So we need to know geographically where they are, what resources they possess. It can be personnel, it can be training that they deliver, and then how, in what way you can work with them. Well, I think exchange of experience is if it's the regional level, the colleagues can exchange experiences and broaden horizons. The same with countries. Countries exchange information among themselves, and everybody may have some best practices and success stories in this is that direction. Indeed, it's a very good comment. Thank you. After this map is done, you've used this instrument when you know who the stakeholders are, what they do, how they can contribute to your program. And it's very important so that they don't harm your program. So when you know all that, then you design and devise a plan of how you work with this stakeholder. In the beginning of the program, you've developed a plan. Do you need to revise it or not? Or you have the program, the plan, and that's it. Say it's a 3 years program. Well, but when will you revise it? On an as-needed basis, somebody said? Without the necessity. So at what stages do you need to revise the plan, in your opinion, of course? Sorry, I didn't hear. It can be done on an annual basis or to do the midterm review when you're halfway through, depending on the duration of the program, indeed. And what about revising this plan in the end of the program? What can be advantages of doing so? Who can say? Well, first of all, revision of the plan in the end gives the total picture of how things were implemented, whether goals are achieved, and what resources were used. And it will help in planning further programs, next programs. Indeed, it was a comprehensive answer. So This is our matrix, our instrument. You will be able to work with it. We will ask you to fill it out, maybe, for 3 stakeholders in your countries. Would be good to have different types of stakeholders like donors, civil society, or local Ministry of Health units. So the first question here is to name the stakeholders, the group or the person or individual, so that we know their names, who they are. Next column, to describe this stakeholder. What is it? Is it a donor? Is it a private person? Is it the public organization? Number 3, their potential role. We will distribute these forms to you, so you don't need to write it down. What is their potential role, vested interest, and also level of knowledge on the issue, so that we know further how to communicate with them, level of commitment. Will this organization be regularly working with you or not? If it's an NGO, the private organization may be interested, but they wouldn't be engaged in daily activities of the program. So level of commitment. What are their available resources? We've said it. It can be human resources, or maybe they've designed some training. They have maybe some special materials, which is like their copyright belonging only to them. And maybe they are known in the country for their training. And the last one, constraints and limitations of the organization or the person. Maybe they have insufficient personnel, maybe they work quite well in one region, but for the other region they may not have sufficient people. So very often stakeholders give out this information, they're quite happy to communicate. So this is the analysis like this. So after you're done with that, then, as I said, we do some sort of a plan of how you work with those stakeholders. And we ask you to take 3 different stakeholders. Then you will pick one and devise a plan for them. Any questions? Maybe something is unclear? Everything's clear?
В программах по ВИЧу есть такое высказывание: ничего.
In HR programs, they have a saying, nothing about us without us. Lately, I hear the same in the TB program. So at the moment of engaging stakeholders, this engagement of stakeholders, it didn't have sufficient attention previously, but we know that these programs that we carry out, they do not work in vacuum, and therefore sometimes the stakeholders can be people that we didn't even think about in the beginning. So I want to ask you to think broader and don't look at, only clinical partners. It can be NGOs, it can be village councils. Many countries do have that. Yeah, they are the stakeholders as well. We know who our stakeholders are, how to find them, how to collect more information about them.
Я знаю, что мы уже все хотим пойти отдохнуть, но еще есть один очень важный стейкхолдер — это медиа. Да, я думаю,
One more important stakeholder is media. I would just take a couple of minutes before you go. I know we will want all to leave, but we need to remember how important this stakeholder is.
серединка. У нас есть доступ и к клиническим, к нашим врачам, к медперсоналу.
And we have access to doctors, to medical personnel, to patients, and we have to express the interests of everyone. And the mass media is one of the important resources.
Очень хорошо, чтобы они правильную, такую, Марина неоднократно говорила, правдивую, реальную
We need to communicate with media so that they also convey correct, precise, accurate, true information, and this information they can receive from us only, so that they do coverage of the TB programs.